We hospitalists think we have an idea of what might lead to lawsuits for us, but the closed claims study is really valuable in offering hard data on what has led to claims for hospitalists. The broad category of claims in the study didn't surprise me so much, but there are three things that did surprise me. One is that the severity of the injury suffered by the patient is much higher in claims brought against hospitalists than in claims brought against doctors in other specialties. The second finding from the study that really caught my attention was the importance of handoff communication. It surfaced as an issue in a number of claims against hospitalists. We all know it's an important issue, but the claims are a reminder of that. And it's not just handoff communication from one hospitalist to the next, but also between hospitalists and other members of the care team. And the third finding that I thought was very significant relates to spinal epidural abscess. That's a disease that's relatively uncommon in the general population, but it surfaced as a reasonably common cause for malpractice suits against hospitalists. The study should serve as a strong reminder for hospitalists of the importance of maintaining a very high index of suspicion for spinal epidural abscess. So that would include patients who have problems like back pain, leukocytosis, and fever. But the literature suggests it really isn't so simple. There's plenty of patients who don't have all three of those, and it requires a great deal of judgment to decide which ones should have the diagnosis pursued. And another thing that's really important is that if you think a patient could have it and it's worth pursuing, you should pursue it now rather than later. So, for example, get an MRI tonight rather than tomorrow.